Hello guys, welcome back to my channel. Today we will be covering management of patients with gastric and duodenal disorders. But before I begin, I just want to say a big thank you to all my subscribers. I have finally reached the 200 mark. So with that said, make sure you like, comment, share, and subscribe. If you have not subscribed as yet, make sure you click that subscription button. So let's get straight to it. So let's begin with gastritis. Gastritis is an inflammation of the stomach, and it is actually a common GI disorder. Now, gastritis can be acute or chronic. So for acute is rapid onset of symptoms, and it's usually caused from dietary indiscretion. Okay, so some examples may include bowel reflux, alcohol, drinking, smoking, some medications, and a strong acidity of food. So acidic foods can cause it. Now for chronic gastritis, it is a prolonged inflammation. So again, acute gastritis is over a shorter period of time, while chronic gastritis is from a prolonged inflammation. This can be caused from having a malignant ulcer, having H. pylori infection. It can be caused from dietary factors such as drinking alcohol and smoking, and it can also be caused from an autoimmune disease. So what are some assessments that a nurse can make when caring for a patient with gastritis? So definitely you want to obtain a history including present signs and symptoms. So are you having stomach aches? What exactly are you experiencing, so we can, draw a conclusion as to why or what could be some causative agents or some causative factors of you experiencing gastritis. So definitely a dietary history, a 72-hour diet recollection, abdominal assessment. So what are some manifestations you can look out for? So for acute gastritis, you can have abdominal discomfort, you might have headache, lassitude, nausea, vomiting, hiccuping. So for chronic gastritis now, you may have epigastric discomfort, anorexia, heartburn after eating, prolonged belching, so you keep belching no matter what you do, you belch, a sour taste in the mouth, nausea, vomiting, intolerance of food. So definitely look out for these signs and symptoms, and make sure you know the difference between the acute signs and symptoms and the chronic signs and symptoms. So what are some plannings for a patient experiencing gastritis? So definitely reduction of anxiety. They don't know what's going on with them, so you definitely, as a nurse, you need to explain to them that this is an acute disorder that you are experiencing right now, and you have to definitely teach them about the maintenance of proper nutrition. Teach them what types of food to avoid. You stay away from your spicy food, your fatty food, and pain relief. Definitely the pain. Remember, pain is subjective. If the person says they're experiencing pain, just definitely do a pain scale and treat them accordingly. But remember, pain is subjective, and you must treat the patient. Right. So when a person is experiencing acute gastritis, again, this is acute gastritis, you definitely want to put them on GI rest. Alright, so you don't want to give them anything by mouth. However, once they start getting back medication or feed or food by mouth, you definitely want to start them off with clear liquids. Alright, again, start them off with clear liquids. Discourage caffeinated beverages, and please, if they can, you teach them about smoking. If they can reduce the amount of times they smoke for the day, that can also help with the symptoms. So because these persons are not getting any nutrients by mouth, you have to definitely monitor for adequate nutritional status. Monitor also for dehydration. Also monitor for electrolyte imbalance. And one important thing with gastritis, they run the risk of hemorrhage. Again, they run the risk of hemorrhage. So definitely look out for signs and symptoms of hemorrhage. This may include vomiting blood, or if they in their feces, their stool might be a dark color. Alright, so their stool may be dark black tarry. So definitely look out for these signs for hemorrhage. So let's talk a little bit about peptic and duodenal ulcer. So peptic ulcer is an erosion of the mucous membrane. Basically what that means is that because of this acidic environment in the stomach, then it forms like a hole, like it creates a hole within the mucous lining, and this can be very irritating to the patient. So they may experience a dull pain or epigastric pain. So definitely look out for these signs. They also can experience heartburn and have vomiting. So peptic ulcer can occur in a few places. So it can occur in the stomach, the pylorus, the duodenum, or the esophagus. So the name comes from wherever the region in where you have the ulcer. So if it's in the duodenum, it's a duodenal ulcer. If it is in the esophagus, then it's an esophageal ulcer. So the name comes from the location of the ulcer. So what are some risk factors of developing an ulcer? So these include NSAIDs, H. pylori infection, which is one of the most common cause, smoking, alcohol consumption, caffeinated beverages, spicy food, type O blood. Again, type O. So if you are type O, then you have an increased risk of developing an ulcer. Also COPD, cirrhosis of the liver, chronic kidney disease. So these are some of the risk factors of developing an ulcer. What are some differences between gastric and duodenal ulcers? Now again, these two are the most common ulcers that individuals do experience, so it is important for you to know the differences between the two. So I'm going to go through the gastric ulcer first. So normal or slightly decreased level of hydrochloric acid in the stomach. Pain immediately after eating. Again, pain immediately after eating. Awakes with pain during the night. Vomiting. Weight loss. Food ingestion increases pain. Again, food ingestion increases pain. Hemorrhage is more likely. So, for example, if this person experiences pain whenever they eat, will they want to eat food at all? The answer is no. So, you have to definitely watch out for them developing anorexia, impaired or imbalanced nutrition, less than body weight requirement. So again, for gastric ulcer, they will not eat, they will have imbalanced nutrition, less than body weight. Alright, so let's move on to duodenal ulcer. Secretes more hydrochloric acid than normal. Again, secretes more hydrochloric acid than normal. Pain 2 to 3 hours after eating, and the pain is relieved upon eating. Again, pain is relieved upon eating. No vomiting, but they will experience weight gain. Alright? So in gastric ulcer, you have weight loss. In duodenal ulcer, you have weight gain. Food ingestion, again, relieves pain, and hemorrhage is less likely. So, if we're going to be monitoring these persons for these signs and symptoms and to differentiate between the two, one of the most important signs and symptoms that you can look out for is weight loss and weight gain. Pain before eating or how long after eating you experience pain. So please remember these. Again, you can develop complications from having a gastric ulcer, so you definitely have to look out for hemorrhage once again. Assess for evidence of bleeding, hematemesis and melena, and symptoms of shock or impending shock and anemia. So this would be what type of shock? If you said hypovolemic shock, then you are correct. So it can be hypovolemic shock because you're hemorrhaging, the blood is not in the correct space where it should be. Also, they may develop septic shock. Think about it. If you have perforation in your GI tract, remember that area is not a sterile area. So if it gets into the peritoneum, which is a sterile area, wouldn't it cause infection and can enter the bloodstream and cause shock? Yes, but the most important one to look out for is hypovolemic shock. So with peptic ulcer, you may also develop pyloric obstruction. So look out for nausea, vomiting, constipation, epigastric fullness, anorexia, and weight loss. So what happens is that this area is irritated so much that the pylorus actually gets inflamed. If it is inflamed, it's gonna cause food. It's gonna cause food to not go down into the duodenum. Correct? So if you have this obstruction, then you will have these symptoms. So let's talk a little bit about perforation. So as I said before, perforation is when there is a hole or a break-in of the GI tract, which can cause the contents to leak into a sterile area, correct? Alright, so some signs you need to look out for, please remember these, are severe upper abdominal pain that may be referred to the shoulder, vomiting, and a collapsed tender board-like abdomen. Remember, this is very important. A board-like abdomen is one of the indicative signs of perforation. You may also develop some signs of shock, so you might have a decrease in blood pressure, tachycardia, so definitely look out for these signs. When you are treating a patient with peptic ulcer, it is most important for you to teach them proper medication administration. So definitely if you are producing too much acid, hydrochloric acid in the stomach, which can be causing the erosion of the mucosal lining, then you want to give them a proton pump inhibitor, for example. Now with proton pump inhibitor, it will decrease the amount of hydrochloric acid that is secreted by the stomach. Alright, so whenever you take this medication, it has to be taken before you eat, because remember, you are trying to prevent the excess secretion of hydrochloric acid. Now, if you take it once you have eaten, then you have just defeated the purpose, because the stomach already got excited already and started digesting the food and everything. So you definitely have to remember, take a medication such as proton pump inhibitor, which will decrease gastric secretion. Take it about 30 minutes before eating, so this will help to decrease the amount of hydrochloric acid produced. One final thing before I go, it is very, very important for an individual to manage their stress. So increased stress can cause what they call stress ulcers. It is basically a gastric ulcer. So you have to definitely teach your patients or help your patient come up with different ways of how they can manage their stress, because this can also cause stress ulcers. With that said, thank you guys for watching this video. I hope you enjoyed it and I hope it was helpful to you guys. Please, before you go, remember to like, share, comment, and subscribe. And as always, I wish you all the best and good luck.